We've recently been contacted by many individuals who have a prosthetic hip known as a Biomet Magnum. It is a metal-on-metal hip prosthesis, and recently there have been lots of reports and studies coming out showing that there are lots of dangers associated with these metal-on-metal hips. Specifically, what happens is the metal-on-metal hips have excessive wear and tear on certain occasions, and what that does is it results in the release of metal particles into the hip joint. There have been recent studies showing that with the Biomet hip, they have a revision rate that is almost 3 times the revision rate of typical traditional hips, which are usually metal on plastic hips. So we've been contacted by clients who have these hips. The typical presentation is somebody who has one of these hips begins to experience pain in the hip joint. Typically that person will go to the doctor, who will do an x-ray, and often the x-ray doesn't show any problems with the hip. And the reason for that is the damage that's caused by these hips and the metal particles is damage to the soft tissue, which doesn't show up on the x-ray. So many of our clients have been going to their surgeon over and over again complaining about problems with their hips. The surgeon will take an x-ray and tell them that there's nothing wrong with their hip. It must be something else. It must be their back. It must be a pulled muscle. It's always something else. And the problems keep getting worse and worse. And it's not until the surgeon actually orders a blood test and discovers that the cobalt and chromium levels are elevated that it all comes together and they eventually figure out what the problem is. And the problem is the excessive wear and tear on the hip. If you have a Biomet metal-on-metal hip and you're concerned, I would encourage you to go consult with your doctor. And if you have questions about your legal rights, we will provide a free evaluation and answer any questions you may have.